course. I mean, we hate a shutdown. I mean, this is the last thing that we would ever want to happen. You're going to have over 50,000 federal employees in New York who have to be furloughed. There's some chatter now that the Russ vote is talking about freezing infrastructure funding that is meant to come to New York. This administration is going to use every single lever to punish blue states, especially for this shutdown. But what we're fighting for is New Yorkers. And we are fighting for health care. We are fighting for the benefits that the Republican Congress and Donald Trump have taken away. And this is our point of leverage, where they need us in order to pass a budget and keep the government funding. They refuse to discuss this with us. They refuse to negotiate. It is their way or the highway. That may have worked with the big ugly bill, which was devastating to New Yorkers, but it does not work with this funding bill. And that's why we are emphasizing so much that they should come to the table and discuss a bipartisan pathway to funding the government. All aspects of the economy are going to be affected one way or another by a shutdown. It is always terrible. And then you are going to have many federal workers who are exempted from the furloughs and are going to be working without getting a paycheck. If this goes on for a long time, this is going to be debilitating and devastating for many, many families. But what we are saying is that the Republicans are causing this shutdown. They have the presidency. They have the Senate. They have the House. It is on them to make sure that the government is kept open. That does not mean that they just go it alone. They can't go it alone if they want Democratic votes. And the point here is all we're asking for is a bipartisan negotiation that addresses especially this healthcare crisis that the Republicans have created. And part of it is the premium tax credits for Obamacare, which will raise, if they are expired at the end of the year, as the Republicans have devised it, they will raise premiums by an average of over 17% for anyone who's on Obamacare, and including over 200% for some people, depending on their income bracket. It's untenable. 4.5 million people will lose health care altogether, and many others will be paying much, much higher premiums at a time when all other costs are going up because of tariffs and inflation. This is untenable what the Republicans have done, and we are here, ready, in the Capitol, with no Republicans, all on vacation, ready to sit down and hash out an agreement that works for the American people. I do have confidence because I think almost everyone, maybe save for those two who changed their vote yesterday, understand that we may need some short-term pain for significant long-term gain. And that if we don't do this right now, then we are unable to do anything going forward while the Republicans are in the majority. Republicans are not even here. They are not interested in doing the work. They are not interested in working in a bipartisan way to address the needs of the American people. And Democrats must stay unified to do that. And this is our opportunity. This is where we need bipartisanship, and we are here for it, and they are not. Yes, there are going to be disruptions. There are going to be slowdowns and various different things. Shutdowns are really, really bad. And certainly this is not something that we ever wanted. And it's not something that, we're responsible for. It is a Republican shutdown. And what we are trying to do is make sure that in the long term, after this shutdown is over, and hopefully it ends soon, that the American people have their needs addressed, which this Trump and Republican Congress have not done. They've done the exact opposite. They're helping their billionaire buddies with tax cuts while they're taking health care away from millions and millions of Americans. That's what they're trying to continue to do right now. And that's what we're fighting against. And so what I urge everybody to do, reach out to my office. It'll be open. We will be working, and we will be trying to identify where the problems are And we'll do our best to work with the Trump administration to straighten things out so that people's lives are impacted as little as possible.
Well, it's quiet right now because at midnight last night, the government shut down, and we'll have a call later today with the OMB director on the parameters that they will outline that will dictate what functions of government are likely to continue. Obviously, we're going to continue to protect the country and protect the food supply, those kinds of things. But it's unfortunate because all we've asked for, just all we've asked for, 7 weeks, so that the appropriations process, which was moving along at a pretty good clip, albeit a bit late, was doing just fine until we ran into this roadblock. We need these 7 weeks back so we can begin moving some of the appropriation bills. We've completed all of the bills through committee on the House side, and we're ready to continue to inch toward the finish line on these bills. A government shutdown stops that. So, forget all the noise about health care and all those other things. Very important issues, to be sure, that we can have a conversation about at an appropriate time. But right now, it's about keeping the lights on in this Capitol, keeping the government operational from a funding perspective, and allowing us to work toward a full year appropriations process, which, as I said, was pretty well underway. We're asking for 7 weeks. I want it to be very simple to the people watching right now. It's a 7-week CR. All it does, it keeps the government operational so that the appropriators can continue, House and Senate, to work toward a full year appropriations package. We're going to have to do this in pieces. And we had one piece pretty well in conference lined up and ready to go with Ag, Milcon VA, and Ledge Branch. But when you shut the government down, you stop that. So, but to your question, there is a time and a place to have that discussion, realizing that the notifications on subsidies are going to go out. But you can't have that conversation as part of this package. It needs to be held separately. It can be done concurrently, but not by taking hostage the workings of the federal government. Frankly, there probably are areas of the federal government that are, shall we say, a little less urgent than others in terms of a government shutdown. But at the end of the day, through the buyout program that happened earlier this year, through the efforts of DOGE, and under other provisions executed by our federal agencies, we've already trimmed that federal workforce dramatically. I worry, however, that a bunch more cuts in the federal workforce are going to start getting into the bone of the activities that the agencies have. For example, the stopping of grants that are going to, accrue to the, across the country, to the universities and to scientific research and those kinds of things. I worry that too many more cuts are going to start impacting our ability to deliver the services expected by the American public. I am prayerful that we do not get into air traffic control and food safety and TSA, those kinds of things that keep us safe, and surely we will make sure that those people are given the highest priority. But look, we're only asking for 7 weeks. 7 weeks, till November 21st. Let's set aside all of the rhetoric and all of the nonsense that's going into this discussion. Let's get this government reopened. Make sure that our men and women in uniform and all of our federal employees are going to continue to receive their paychecks, so we're not hard-shipping them unnecessarily, and that we can continue to move an appropriations process through to fruition, which we were well on our way to do. I'm going to listen to the OMB director. I think we have to be careful that we don't create a situation where the other side doesn't want to enter good faith negotiations with us on matters of appropriations because they fear that some of those deals that we might make will be rescinded later by OMB. So those are the kinds of things that concern me a little bit. We've got to look. It's a numbers game right now. We have 53 votes on the Republican side in the Senate. We have 219 votes in the House. And so we can only lose really 2 people on a House vote, on a partisan bill. So the sum total of all that should tell anybody who's thinking objectively that whatever the outcome is on any major piece of legislation, short of anything in reconciliation, you're going to have Democrat votes to do that because of the 60-vote filibuster in the Senate and because of the narrow majority in the House. So I continue to remind people that we've seen this before, and it's a bipartisan solution that's probably going to be necessary in order for us to crawl out of this dilemma that we're in right now. Going into the shutdown, not so optimistic, except for the fact that besides Fetterman on the Senate Democrat side, you had two other Senate Democrats, King and I guess our New Mexico senator, that both voted to keep the government open. So that's two more than what we had the first time around. Now, we still lost Rand Paul. So I'm hoping that maybe today there might be one or two more that, feeling the pressure, will come around and agree with us that 7 weeks is not an unreasonable ask in order to keep this process going.
We are pretty well final on the substance of the bill, and now we need to make some strategic decisions about whether the House or the Senate go first.
Well, for me, it's basic math. For anyone that's watching it, is now back in March there were 10 Dems. And there are 2 that are absolutely off the table. So that leaves that there's 8 left. And that are all required to reach 60. So even if one does not, then it's 59 and it's moot. So I don't see how that's going to, other than one side blinks at this point. Because otherwise, the only gettable or theoretical votes from the group back in March, they all have to show up, and I'm not sure if that's even possible now.
Most Democrats, or many of them, think Republicans might come to the table on the ACA subsidies, that's negotiable. Do you think that might bring Republicans on board, even if Democrats don't vote?
I don't know what they're thinking, but for me, it's like it's wrong to shut the government down. 2 things are true. Hey, I absolutely think we should reconsider some of extending these tax credits, but we shouldn't be shutting the government down. I just want to be reasonable through this. For me, it's our core responsibility, and it's not who takes the blame or this, because the one people that are really going to get hurt are the millions of Americans that depend for our government to stay open.
And just last one, have you gotten pushback from constituents or from your fellow Senate Democrats for voting for this?
I mean, I think overall, I think anyone that follows our votes is like I'm voting for the Democratic CRs about the tax credits, but I've made very clear that we shouldn't shut the government down. And when the Republicans did that, we were very critical. So I think it's like I said, it's a core responsibility to keep the government open and functioning.
Do you see any progress at all?
Look, members are having conversations with one another. We're all duly elected members of the Senate. We all have a responsibility here. I'll just remind you that Republicans are in charge of the House, the Senate, and they have the White House. We should be working together. You know, it's not lost on any of you that when Democrats were in the majority in the Senate, there was not a shutdown. You work together. You have to listen to one another. And when it comes to our constituents, that should be front and center to everybody. I come from a state where healthcare is real. I survived a stroke 3 years ago. You get hit with something like that, time's not on your side. You need to go see a doctor right away, or your chance of healing diminishes, your chance of living diminishes. It's not right for the American people to be worried about those insurance costs getting jacked up and people losing coverage, and in the face of what happened with food programs and all the rest, costs are just going up, 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 up. So, look, I hope that we can all work together. I get my Republican colleagues are in the majority. They have the votes, the majority votes, but we have to work together. That's what the American people sent us here for. So God willing, we'll see all of that. As long as members are talking to one another, there's always a chance for a solution. I mean, I've only been a member of this body for 4 years now. And I've seen moments where people thought that there was an impasse on whatever the policy was, and snap the fingers, there's a solution, there's a resolution, people work together and get it done. There have been several votes, as I was asked earlier, that could have provided a path forward here. Those votes failed. We have to continue working together as well. So, again, I'm prayerful that we can get this done. And as long as members are talking, that's a good thing. And they just can't lose sight of the impact of the American people on all sides of this. That's who we're here to represent, and that's who should be at the forefront of all of our conversations.
Are there any specific items that are being discussed that it seems there could be a compromise on?
People are talking all kinds of ideas. I'm not going to speak for my colleagues that are offering different ideas. You can chat with them as well. But there's all kinds of ideas that are being shared, and ideas that some I imagine would support, and ideas some might not support. But without a conversation, you never get to the next step.
In previous shutdown,
sticking points over anything other than healthcare. No healthcare front and center, as you mentioned. But are there other sticking points too?
Look, the American people right now and constituents of mine all across New Mexico are about to get prices jacked up more and more and more. It's not just those that depend on the tax credits with the Affordable Care Act. This is going to increase insurance costs for everybody in the face of Medicaid getting dramatically reduced, arguably every federal dollar getting taken away from the American people. Those costs are going to go up and up and up. And, you know, make no mistake, if you lose coverage, you get forced to the emergency room. If you go to the emergency room, you can't pay the bill. Those costs don't go away. They get passed on to everybody else. All of you. You'll all be paying more for insurance. Every journalist here that's fortunate to have that health coverage today. That's what we're talking about here. There's got to be a better way to do this. And so, again, I'm hopeful that people can come together. I know my Republican colleagues care about their constituents, being able to go see a doctor, go to a hospital if they need to without losing their home because they can't pay a bill. I know that when I talk to them. Let's vote to make this happen.